Once you enroll in a Medicare Supplement plan, are you really stuck with that same plan forever?
I'm stuck!
Is it truly as hard to change your Medigap coverage as people make it seem? Technically speaking, it is possible to change from one Medigap plan to another anytime 365 days of the year. However, making this switch does come with the very important caveat that you can qualify for the new Medigap plan. There are generally 3 different enrollment opportunities that will impact your ability to qualify for a new Medigap plan, and it is crucial for you to know which of these opportunities will work best for you. Now, to do this, we like to visualize a flowchart for changing Medigap coverage. At the top of this flowchart is your Medigap Open Enrollment Period, followed by guaranteed issue rights, and then finally with medical underwriting and health questions at the bottom. Now, in this video, we are going to focus on the first 2 options of this flowchart, which will allow you to change from one Medigap plan to another without answering health questions. This includes your Medigap Open Enrollment Period or guaranteed issue rights. More importantly, we are going to explain the actual process of changing plans and what it looks like during these 2 enrollment opportunities. First, my name is Cameron Giardini, and I help operate our family-run Medicare-focused insurance agency called Giardini Medicare. To connect with one of our agents and find a list of educational Medicare resources that we provide, you can do this by going to doineedmedicare.com or just give us a call to schedule a phone appointment. Also, please make sure to subscribe to our channel and turn on notifications so that you are notified when part 2 of this video comes out about changing Medigap plans through the underwriting process and actually going through health questions. So starting at the top of our changing a Medigap plan flowchart, we have the Medigap Open Enrollment Period or Medigap OEP. Don't just take our word for it, but according to the 2024 Choosing a Medigap Policy Handbook, this is the best time to buy a Medigap policy, and this also includes if you are trying to change from one Medigap plan to another. Just keep in mind that when I say Medigap OEP in this video, I am referring to the Medigap Open Enrollment Period. Now, in our previous video that you can see here on the screen about Medicare Supplement enrollment timelines, we discuss in more detail when the one-time Medigap Open Enrollment Period occurs, but as a reminder, this period lasts for 6 months, and it starts the first month you have both Medicare Part B and your 65 or older. You can also see here on the screen some of the protections this Medigap OEP provides to you, but to make things simple, this time frame allows you to enroll in or change Medigap coverage without being denied due to pre-existing conditions or your current health status. This Medigap OEP, it is also available to individuals that were eligible for Medicare before age 65 and are now turning 65.
Can you believe it? I get a second chance.
So in this situation, you would still have access to a Medigap OEP. Again, this is a one-time enrollment period connected to when you first begin Medicare Part B and you're 65 or older, and this should not be confused with the annual election period, which occurs from October 15th through December 7th. Now, this is often confusingly referred to as the Medicare Open Enrollment Period, but that fall enrollment period, it does not give you the opportunity to change Medigap plans without answering health questions like during your 6-month Medigap OEP. Since this video is focused on what you should know when changing from one plan to another, what if you want to make a change during your Medigap OEP to a different Medigap plan? So for example, we will look at Becky, who retired in May of 2024 at age 67, and she started her Part B of Medicare on June 1st, so her Medigap Open Enrollment Period would last for 6 months until November 2024. Becky originally enrolled in a Medigap Plan G effective June 1st using her Medigap OEP. However, in July, Becky stumbled upon our video about Medigap Plan G versus Plan N, and now she wants to change from a Plan G to Plan N still during her Medigap Open Enrollment Period. So what does this process look like for her, and what should she consider? First, although your Medigap Open Enrollment Period allows you to enroll in a Medigap plan without answering health questions, and you can buy any Medigap plan sold in your state, this does not mean you can enroll in any or all of the plan letters that you can see for Medigap plans in the Medicare and You Handbook without restrictions. you will still be limited to certain plan letters that you are eligible for. This means that if you are first eligible for Medicare on or after January 1st, 2020, you are not eligible to enroll in Plan F or Plan C, even during your Medigap OEP. Now, thankfully for Becky, Plan G and Plan N, they do usually provide a better value compared to Plan C or Plan F, so although she is not eligible for those plan letters, she can still make that change from Plan G to Plan N. Next, understand that although we mentioned you do not have to answer health questions while applying for the Medigap coverage during your open enrollment period, you might be surprised to find that in some states you can still be charged a higher monthly premium for your Medigap plan if you use tobacco products. In fact, here on the screen, you can see a map of states that allow Medigap companies to charge a higher premium for tobacco users even during your Medigap OEP. For example, when quoting a Mutual of Omaha Medigap plan during open enrollment here in Michigan, it does not even ask about tobacco usage. However, when quoting a similar plan for someone in Oregon, it does ask for tobacco usage and it does increase their premiums if the answer yes is selected to using tobacco products in the past 12 months, even during this Medigap open enrollment period. However, not all companies will charge tobacco rates during the Medigap OEP, even in states that do allow it. For example, we have Aetna, who typically does not charge for tobacco rates even during Medigap OEP, again, even if they are allowed to charge more. You can see this by using their online quoting system and changing the tobacco answer from yes to no, and this does not impact the monthly premium rate. This is why it is important always to use the help of an independent broker familiar with the different Medigap plans available in your state. Once you have determined the specific Medigap plan letter and the insurance company you want to make a change to during your Medigap OEP, what does this application process actually look like? Well, as we have mentioned a couple of times, you won't have to go through medical underwriting and answer health questions to qualify for the new plan. So here on the screen, you can see a list of some of the typical health questions on a Medigap application. However, when applying for coverage during your Medigap OEP, these essentially disappear. This can even be seen when completing the online application for a Medigap plan, because once you are determined that you're in your Medigap OEP, it is not even possible to click on the section containing the health questions, as you can see. However, you should still know that some personal information will be required from you during the application process. Now, this will vary slightly from one company to the next. This may include requiring your full name, address, Medicare ID number, social security number, as well as payment information in the form of a bank routing and account number. And of course, there is other personal information possible. So just be prepared for that when you're completing an application with a broker. Also, you should know that some Medigap companies, they will require you to pay a one-time application fee when you're applying for a new Medigap plan. If charged, this fee is usually $25 added to your first month's premium, as you can see here on the quoting tool we use to find Medigap plans. If you're applying for a new Medigap plan during your Medigap OEP, don't forget about the process of canceling your current Medigap plan to avoid duplicate coverage and wasted premiums. Looking back at Becky, if she applied for a new Medigap Plan N in July for an August 1st effective date, once the application for the new plan is approved, only once it's approved, she should cancel her current Medigap plan with a cancellation date effective at the end of July. Now, this can be done by calling the insurance company providing her Plan G to request a cancellation over a recorded phone line.
I want to cancel it!
But we do also recommend submitting a cancellation request in writing. And here on the screen, you can see an example of this cancellation template that United Healthcare has provided. We will also link to this as a PDF in the description below. Overall, there is no limit to how many times you can change Medigap plans during your Medigap OEP, but although it is a relatively easy process to make a change, we don't recommend chasing new plans with the lowest possible premiums, as we have talked about, of course, in previous videos. Instead, the goal is to choose a Medigap plan letter and a Medigap insurance company during your Medigap OEP that you are comfortable with for years to come. In addition to watching our other video about how to choose Medigap plans, you can also do this by scheduling a one-on-one phone appointment with one of our brokers. So moving on from the Medigap open enrollment period and going back to our changing a Medigap flowchart, what if you want want to change from one Medigap plan to another, but you are outside of the time frame for that one-time Medigap OEP. The next option you should consider is whether or not you're eligible to change to a new Medigap plan using guaranteed issue rights. Now, according to the Choosing a Medigap policy, guaranteed issue rights or Medigap protections, they are your rights to buy a certain Medigap policy in limited situations outside of your Medigap open enrollment period. Now, in these situations, an insurance company must sell you a Medigap plan. They must cover all your pre-existing health conditions, and they can't charge you more for a Medigap policy because of past or present health problems. However, just like during the Medigap OEP, tobacco rates can still apply in some states and certain companies, even if you qualify for guaranteed issue rights. Now, under federal law, various situations give you access to guaranteed issue rights to purchase a Medigap plan during a specific period of time. This typically lasts up to 63 days after your previous coverage ends. On the screen, you can see these guaranteed issue scenarios listed in the Choosing a Medigap Policy Handbook. However, since this video is about changing your Medigap coverage, it is important to know that many of these different situations won't help when it comes to changing from one Medigap plan to another. For example, if you are currently enrolled in a Medigap plan, one of the few situations that may provide you guaranteed issue rights to enroll in a different Medigap plan would be if your current Medigap insurance company goes bankrupt and you lose your coverage, or your Medigap policy ends through no fault of your own. Although Medigap plans pull out of markets relatively often, it is very uncommon for a Medigap company to actually go bankrupt, causing you to lose coverage. Also, it is very important to note that if your current Medigap insurance company closes your specific plan's block of business, this is not the same as a plan going bankrupt, and it does not give you access to guaranteed issue rights to change to a new Medigap plan without health questions. Of course, to learn more about the topic of opening and closing blocks of business, please make sure to watch these two videos that are shown on the screen after this one. Also, in other videos, we have discussed how moving outside of your Medicare Advantage plan's service area can give you access to guaranteed issue rights, but just know that is not the same as if you're moving with a Medigap plan. Now, because Medigap plans are portable, the plan coverage moves with you even when moving out of state, and this does not qualify you for guaranteed issue rights to change to a new Medigap plan since you're not losing coverage. An exception to this is if you are enrolled in a Medicare Select policy, which is a type of Medigap plan available in some states, and it requires to use hospitals and in some cases doctors within its network to be eligible for full benefits. Lastly, when it comes to understanding these federal guaranteed issue rights, as you may have already seen, not all Medigap plan letters will be available to you if you're eligible for guaranteed issue rights. This will vary based on different situations for why you're losing coverage, but using our previous example, if your Medigap company were to go bankrupt, you would have access to Medigap plans A, B, C, D, F, G, K, or L. Sorry, it's a mouthful. And you have access to any of those plan letters sold by an insurance company in your state. Furthermore, your ability to enroll in Plan F or Plan G using guaranteed issue rights, that will depend on when you were first eligible for Medicare. So for example, if you were first eligible for Medicare on or after January 1st, 2020, if you have access to guaranteed issue rights, you would be eligible to purchase Plan D or Plan G without health questions. However, if you are first eligible for Medicare before January 1st, 2020, you would instead be eligible for Plan C or Plan F and not Plan D or Plan G using guaranteed issue rights. For example, if you first turned 65 and became eligible for Medicare in 2018, and you also enrolled in a Medigap Plan G at that time, and then that company providing that Plan G went bankrupt and you lost your coverage, you would be eligible for Plan F from a different Medigap company using guaranteed issue rights, but you would not be eligible for Plan G based on the federal guidelines. Instead, if you want to enroll in a Plan G in that case, you would likely have to go through the process of health underwriting and answering health questions. We will of course discuss this much more in our upcoming video, so again, please make sure to subscribe to our channel so you don't miss that. You may also have noticed that for many of these guaranteed issue scenarios, Plan N is not available as one of the available plan letters. We discussed the benefits of this in more detail in our Plan N versus Plan G video, so make sure to check that out. When it comes to applying for a new Medigap plan using guaranteed issue rights, the process is similar to what we previously discussed during the Medigap OEP, but you will have to answer various questions to confirm your guaranteed issue eligibility. Even more importantly, as seen on this online application example, you will have to submit proof to the new insurance company that you are in fact eligible for guaranteed issue based on one of these scenarios we discussed, and the application won't be approved until that proof is received. Therefore, you can't simply lie on the application just to say you have guaranteed issue rights if you don't actually. So if you're currently enrolled in a Medigap plan and none of the federal guaranteed issue situations apply to you, does this mean that you have to answer health questions to change plans, or are you simply out of luck?
And I really just don't want to answer questions about anything.
Well, maybe not. As we have mentioned in other videos, there are just over a dozen states with unique guaranteed issue enrollment periods, and you can see a list of these states here on the screen. Just know that each state is not created equal when it comes to your ability to change Medigap plans without health questions. We won't have time to discuss each state's unique rules in complete detail, but we will highlight some differences right now. Also, in the description of this video, we will link to a guide explaining the different rules for each of these states. First, we often discuss, or you have probably heard about states with Medigap birthday rules. Now, these states, they include Oregon, Idaho, California, Oklahoma, Nevada, Kentucky, Louisiana, Maryland, and Illinois. Not all Medigap birthday rules give consumers the same rights, though, when it comes to changing Medigap coverage, which we will highlight using California versus Illinois as examples. Now, in California, according to the Department of Insurance, Medigap policyholders have a 60-day open enrollment period following their birthday each year, during which time they can switch to a new Medigap policy without medical screening or waiting periods. Now, in this case, the new policy must offer the same or lesser benefits as the current one. So for instance, a switch from a Plan G to another Plan G, or a switch from a Plan G to a lesser Plan N is permitted, but it's not permitted to go from Plan N to Plan G, as in this case, the Plan G would offer more comprehensive benefits compared to that Plan N. As always, consulting with a broker is advised for a smooth process. In contrast, Illinois has a more restrictive birthday rule. The open enrollment period, it starts on one's birthday, but it lasts only 45 days, and it is only available to individuals between ages 65 and 75. Here, policyholders, they can only switch to a new Medigap plan offered by the same insurance company, and the new plan must not exceed the benefits of the existing one. So for example, you could change from a Plan G with Aetna to a Plan N with Aetna, but not from a Plan G with Aetna to a Plan N with Mutual of Omaha, or another company. There may also be restrictions in this case for closed blocks of business, so again, overall, this is much more restrictive than the California birthday rule. Now, somewhat similar to states with birthday rules, Missouri provides what is known as an anniversary rule. According to the Missouri Medigap Shopping Guide from their Department of Insurance, you have the right to switch insurance companies each year during the 30 days before or after your policy's anniversary date. And this is the date when your policy first started. Now, unlike the birthday rules that we discussed, this anniversary rule, it only allows for changing to a same lettered Medigap plan, but at least it does allow you to change to a new Medigap company. For example, you could change from a Plan G with Medigap Company X to Plan G with Company Y, but this specific rule doesn't provide rights to go from Plan G to Plan N or vice versa. Now, last but not least, in our category of states with unique Medigap underwriting rules, some states like New York, they actually provide year-round open enrollment for their Medigap plans. So according to the New York insurance website, any insurers writing Medigap insurance must accept Medicare enrollees' applications for coverage at any time throughout the year. However, before you get excited about this opportunity, just know that because of this rule, Medigap plans in New York have much higher premiums compared to most states, and you can see this by looking at these different quotes. Although the rules will vary a little bit, some other states that may allow you to make a change to your Medigap plan year-round without health questions include Massachusetts, Connecticut, Vermont, Washington, and Maine. Also, keep in mind that a few states that currently have birthday rules, they have just created them in the last few years, so make sure to always check in the future if your state decides to implement a new one. Overall, the key to remember from this video is that when possible, you should first consider opportunities to change your Medigap coverage without having to answer health questions. However, if you have gone through our Medigap flowchart and you are not eligible for Medigap Open Enrollment or Guaranteed Issue rights, or you simply want to apply for a plan that is not available through Guaranteed Issue, your next step will be learning about the process of changing Medigap plans through medical underwriting. Thankfully, this is exactly what we are going to cover in our next video, so make sure to subscribe and stay tuned. In the meantime, watch this video that YouTube recommends for you next.